Hello warriors, I am Kelly and this is my channel Incredible Anyway, where I talk about how to live an incredible life no matter what your circumstances are. This video is part of a video series I am doing called Diagnosis Discussions. And in this video, I'm going to be talking about my new daily persistent headache diagnosis. But before I continue, it's important to remember that chronic health issues don't always look one way. As with any disease, there is a spectrum of illness, meaning that it can affect some people more than others, and even in the same person, they can have their illness affect them differently from one day to the next. So everyone is different, and that's all right. My experiences that I share about new daily persistent headache in this video may be different from the experiences you've had or somebody that you know, and that's okay. In the description box below, I'm going to be giving a lot of helpful links about new daily persistent headache, including links to the other videos in this diagnosis discussion video. So let's get started. New daily persistent headache is something I'll also be referring to as NDPH, which are the letters of new daily persistent headache. It is an enigmatic headache disorder. It's considered a primary headache disorder, which basically means that no other health condition or disease has caused it. And it's a relatively new diagnosis compared to other things like migraine, in that it was just added by the International Headache Society as a diagnosis in 2004. And it's classified as a chronic daily headache. The name new daily persistent headache actually describes the features of this headache. New. It's a new headache. Basically, a person like this hasn't had many headaches before, and if they have, it certainly hasn't been like this one. Daily. Since the onset of the headache has been daily. Persistent. It has been present for more than 3 months of continuous pain. Headache. Resembles a migraine or it resembles a tension type headache. With this headache, it starts suddenly and just never stops. Unlike migraine, new daily persistent headache typically isn't exacerbated by physical activity or movement. Other types of headache can actually mimic NDPH, so it's really important to see a neurologist that specializes in treating headaches so that they can rule out the other types of headaches or migraines that may mimic new daily persistent headache. The NDPH headache starts suddenly one day, becomes persistent, unremitting, and immediately becomes daily. Usually, patients who have this type of headache clearly remember the exact date. Some people even remember the exact moment their headache started. So just like other patients with new daily persistent headache, I can remember the exact date that my headache started, October 26th of 2005. And I have had head pain every second of every day since then. I frankly don't know what it's like to live without head pain. The NDPH headache can be throbbing like a migraine or tightening like a tension type headache. It's typically on both sides of the head, and the severity can vary from mild to severe. I have bilateral head pain where it hurts on both sides and it's more pressure-like and kind of a tightening feeling. Sometimes it is more mild, sometimes it's more severe. It tends to live in that more moderate area for me. A study in the medical journal Headache revealed that in 50% of patients with new daily persistent headache, they know the circumstances that triggered the headache, and in 50% of the patients, they don't. So when they know what triggered the headache, they're one of three things: either an infection or a virus, a surgical procedure, or a stressful life event. I also remember the circumstances around how my new daily persistent headache started. I had a really bad bout of food poisoning, and in the research, that's something that people will commonly report as salmonella. I also was working at a job where I was exposed to a lot of mold. I had gone into a room that normally nobody went into that had a ton of mold, and I had a really extreme reaction to that because I'm very allergic to mold. And I also believe that that contributed to the initiation of my new daily persistent headache. There are two types of new daily persistent headache. The first one is self-limiting, which basically means that the headache goes away on its own without treatment in less than 2 years. The other type is refractory, which means that the headache does not respond to treatment and the head pain can go on for years and years and years. At the time of filming this video, there are no specific treatments outlined out there for new daily persistent headache. A lot of times doctors will prescribe medications based on what the headache is most like, whether it's most like a migraine or most like a tension type headache. The medical Journal of Headache and Pain says that new daily persistent headache can be one of the most treatment refractory primary headache disorders, and it can be incredibly disabling to individuals. And pretty much it's disabling because it's so hard to treat. While I have tried a lot of different medications, none of the medications that I have tried has helped the new daily persistent headache, not even a little bit. The pathophysiology of new daily persistent headache isn't really well known. The research is kind of pointing to an immune-mediated inflammatory response, also known as chronic central nervous system inflammation. It also has pointed to cervical spine joint hypermobility as maybe one of those reasons is the cause. However, these things are just speculative at this point because there's not really been any research studies done to prove or disprove that. If you have new daily persistent headache, oh my gosh, my heart goes out to you. I know that this can be a really challenging health issue to have. We have to keep hoping and we have to keep putting one foot in the front of the other. If you have new daily persistent headache or know somebody who does, I would love to talk to you. Please write in the comments section. I'd love to hear what your experience is with NDPH. If you have any questions about NDPH, please feel free to ask them. I'd be happy to answer your questions. I know that chronic health issues like new daily persistent headache can be so challenging. I also know that it is completely possible to live an incredible life no matter what the circumstances are. Thank you so much for watching this video, my new daily persistent headache and my diagnosis discussion series. If you like this video or it helped, please give it a thumbs up. That would help me out a lot. I am Kelly, and remember, you are not alone. Love you guys. Bye. Cut. It also has pointed to cervical spine joint, no, I'm saying that wrong. Cervical spine joint hypermobility. I had it right. Whoa. Weird Kelly. Weirdo Kelly. Too bad I don't do bloopers. We'll see.
I'm just having a good time.